Hey, thanks for joining Dr. Peter Wood and I for a chat. We're talking about cervical screening, pap smears.
Again, something we don't talk about on TV very much, but it's super important.
Yeah.
Australia has one of the best cervical screening programs in the world.
Good to know.
And when they introduced the pap smear program 20 or 30 years ago, it drastically reduced cervical cancer.
Right.
It's a nuisance to have that examination.
Yeah.
No one likes it.
It's very uncomfortable.
It's not comfortable.
No.
And there are a few things you can do to try and
so
make
people
it better.
People would avoid.
Because it's just like no one wants to go there,
So
right?
how often should we be checking?
Firstly, we'll talk about how to go through this examination without actually getting killed, right? So I would recommend that you go to somebody that you know and trust. Because having that trust situation in a safe environment, you're more likely to find it less uncomfortable. If you go to a complete stranger, or if you struggle with these examinations, that maybe not make it difficult for you. In Australia, the cervical screening program starts at age 25.
Oh, okay.
Or if you have unusual bleeding symptoms, like bleeding after intercourse or bleeding in between your periods that can't be explained.
I thought you were supposed to get cervical screening or pap smears done after, you know, when you've had intercourse or something like that. What's the rule? Oh, okay.
So it's changed recently because now we're actually doing a test looking for HPV, which is a virus, because we know that nearly all cases of cervical cancer are associated with some types of HPV, human papillomavirus. And so if you don't have that virus there, then you are so low at risk of having any cervical cancer that we can test you every 5 years.
That's what they're looking for?
Nowadays, they're looking for HPV virus. They're doing a test to see if there's virus there or not. If the virus is there, then there's further testing that can be done. So if you do the test and there's no viruses there, then you're sorted out for 5 years.
5 years.
So that's what's really important.
So we don't have to get uncomfortable for another 5 years.
Correct. You know, but if there is a virus there, then there may be further testing to be done. That may involve doing a repeat test in 12 months' time, or it may involve going and seeing a gynaecologist and having a procedure called a colposcopy. And what a colposcopy is basically a pap smear that takes longer. That's all. It's nothing scary. It's just looking very carefully at the cells in your cervix and taking a biopsy if we need to. All of this can be done, you know, in a comfortable way.
Yes.
But the trick is to do it, right? Because in Australia, the only women who get cervical cancer are those who haven't had a pap smear in the last 5 to 10 years. And so it's just a simple thing to benefit you. And the program in Australia has radically reduced the risk of cervical cancer and the incidence of cervical cancer.
So after 25, after the age of 25, women should be getting this test done
every 5 years.
And then get it done every 5 years.
Unless there's an abnormality, then it'll be done earlier.
So important. We need to get ourselves checked out.
Just got to do it.
That's right. Thank you so much, Dr. Peter Wood, for your time. And look, get yourself checked out, ladies. It's so important to keep ourselves healthy. Keep it locked right here. Mums at the table for this information and more women's health issues and more.